integration project. So the early childhood comprehensive systems health integration project. Won't ask anyone to repeat that back. And we are really thrilled to be kicking off this 4-part webinar series over the course of the next, it'll happen between now and May. So this first session here that we are going to cover today is innovative approaches to care coordination. And so that's what we'll cover today. So a little background on the ECCS project. So JSI and New Hampshire Family Voices are currently co-directing this project. It is funded by a CDC grant through DHHS, focused on reducing health disparities and helping strengthen connections between families and healthcare services that they need. So helping strengthen that referral pipeline. And so we are also in the midst of getting ready to launch our a rapid micro grant project as part of this work just this week. So we're just thrilled to be moving all this work ahead. So today on the call, what we are going to go through, or actually the webinar series, again, between now and late May, early June of 2024. Similar to kind of the overall theme is helping healthcare and other social support professionals looking to strengthen those connections that they're making for New Hampshire families with the services they need, and just providing a space to learn some new things, hear about some best practices and other opportunities to support families. So we have care coordination today. But over the course of spring, our other topics will cover cultural humility and data collection, different childcare needs in New Hampshire, and how healthcare can play a role in connecting families. And then we're going to actually close out the series with an exciting presentation from some partners who have been working on implementing a pilot project to deliver, serve, use plans of safe care in a new format. So as binders and kind of reframing them as family care plans. So JSI has been working with a few practices from across the state. And at the end of our webinar series, we'll be able to hear from those teams about how that pilot project went and lessons learned. So for today's webinar, what we will be going through, we're going to be describing the various models of care coordination for families. We're going to list ways that you can meaningfully engage families in care coordination improvement work, talk about some of the challenges to effective care coordination. And we hope that everyone is able to walk away from the webinar with at least one innovative practice or idea that you may be able to feasibly apply or explore in your own setting. A few housekeeping items. If you have questions, you can go ahead and please put them in the chat. We are recording this session, so we will be sharing a link to the webinar along with other materials that may get referenced after the webinar. There will be an evaluation link that is shared at the end. Please fill that out. And then lastly, with all of the snow and cloudiness, we may have some internet connectivity issues. If for whatever reason someone drops off or one of our speakers drops off, please hold on, or if you get disconnected, come right back to this link and we will pick right back up. So, all right. There we go. Those are the housekeeping items. And so now I would like to introduce or just kind of set the stage for our speakers today. We have Sylvia Pelletier, who's the director of New Hampshire Family Voices, and Kendra Dix, who is also working with New Hampshire Family Voices and is the coordinator for the B8 Family and Community Advisory Team for the Council for Thriving Children. I am going to have Sylvia and Kendra introduce themselves and kind of go through a quick bio, and yeah, we hope you enjoy the presentation. So thanks.
Good morning, everybody. I am Sylvia, and as she said, I'm the director at New Hampshire Family Voices. I've been there since 1999, and like almost all of our staff, I'm a family member, someone with lived experience who works and serves in this capacity, and we're thrilled to be with you today. Part of my work has really always been in quality improvement. I've done a lot of work with practices around medical home and initiatives, so have some experience in engaging families in that work. Kendra.
Hi, everyone. My name is Kendra, and I also have lived experience. I am a mom of 5 kiddos, one with congenital heart disease. And my role at New Hampshire Family Voices is to really encourage families to speak up and to use their voice. And so I'm the coordinator for the Birth Through 8 Family and Community Advisors. And we have a direct connection to the governor's office for feedback. Whether that's information that gets handed out to families or information going to families. We're able to share what is happening in real time with families at the government level. So we're happy to be here today.
So today we're going to talk about some innovative approaches to care coordination. And as we've already referenced in our introduction, we're family members first and foremost who've done some systems work. So we don't bring a lens of practice to this work. We bring the lens of what families say about this experience. Next slide. Kendra, that's
Yep, go ahead. Thanks. For those of you who don't know who New Hampshire Family Voices is, we work alongside PIC, Parent Information Center, and it's our job and our pride to give families in New Hampshire and those who work with New Hampshire families the resources and training information that they need to help children in their care learn and thrive.
So what does that work look like? So at the PIC side, they tend to focus really on the education systems. And on the Family Voices side, we tend to focus on the healthcare side of things. And we don't mean healthcare just meaning the medical care piece. We also mean those community services that meet the needs of that child in the community. So we do a lot of systems navigation for families, helping them to find where they're going to get their needs met within the community, and then a lot of system strengthening activities across both of those sides of the system. We already covered.
Oh, go ahead.
I was going to say, Kendra, we already covered this.
We did, yeah. So yeah, there you go. Perfect. Thank you.
So before we talk about innovative approaches to care coordination, we thought it would be helpful to define it. So I assume many of you are familiar with the national standards, care coordination standards for children and youth with special healthcare needs that came out in 2020 through NASHP. And this is the definition that we often refer to since that came out. And it really defines care coordination as this patient and family-centered, assessment-driven, team-based activities that really are designed to meet the needs of children and youth. I think what's really important about this definition, it really speaks to that it addresses all of the things that a family might need. It's not just the medical pieces, it's the social and the developmental, the behavioral, the educational, and the financial needs that a family might need addressed in order to achieve those health and wellness outcomes. And that it's really necessary to achieve an efficient services and resources, both within a system, but also across the systems that serve families. So it's a really comprehensive definition of what care coordination is intended to do as best practice.
Yeah, and I think it's important to remember too, as a family member myself, being a part of care coordination in my personal life with my daughter, I had no idea what that was. And even as a staff member of New Hampshire Family Voices, completing this webinar with Sylvia, we had some great conversation about how it's important to remember that even though this is your day-to-day and every day of what you're doing for work, families often don't know what it means. So giving them time to process and understand all the supports that they do have is really important.
So the standards actually break out care coordination into these domains that really speak to what should happen and how it should happen. And the first domain is really screening, identification, and assessment, because it provides the foundation for what care coordination does, right? That every child who's eligible for or potentially eligible for care coordination has some form of screening, identification, and assessment that not only identifies the child's needs, but family's preferences and priorities. And in the standards, it speaks to this being an ongoing process, not something that's one and done. That a shared plan of care is really the roadmap. It integrates care for that family. So once the assessment is done, that a shared plan of care is developed, and that provides the roadmap to the journey that family's on. It really outlines how team-based communication should happen between all members of the care team that are working with that family. And there's a focus on child and family empowerment and skills development. So it speaks to the training that occurs for families as part of this process as a care coordinator is working with families, that they're really working with families to empower that child's well-being and to help team members also grow in their understanding of what they need in order to serve that family. The standards speak to the care coordination workforce, not just in terms of what training care coordinators might need to perform these roles, but also speaks to what ratios are manageable for care coordinators to do this work in the way that the standards outline. And the last thing it speaks to is really speaking to care transitions, and making sure that those transitions across systems are integrated. So it really speaks to whether or not this is education, this is a kiddo going from birth to 3, early supports and services to preschool, or whether this is a kiddo who's hospitalized and going home, that all care transitions are planned for and integrated. So there's not that scenario where kiddos are falling off the map and families are lost. So there are lots of models of care coordination, as you might imagine, and a lot of them are geared in the adult healthcare funding system. So we're focusing today just on the models that really apply to young children in New Hampshire. And so, as we know, care coordination, regardless of what it might be called, happens in a variety of settings. And it really can vary greatly in terms of its focus, and whether it's an ongoing process or something that's a little more episodic in nature. It looks very different, which really leads to that confusion for families when they say, do you have a care coordinator? They don't all look the same or act the same. So families are often confused by what that means. So for children who have special healthcare needs, particularly, they're often assigned multiple care coordinators, and these can be within and outside of the healthcare system. I think the one many of us are familiar with are those that are connected to the patient-centered medical home, and that's primary care focused. I think any of us on the call can say that we know care coordinators that sit in a pediatrician's or a family practice office, but their function might be quite different based on the capacity of that practice. The next model that often applies to kids is a chronic condition or chronic care model. And again, that looks different from the way it looks in adult healthcare, where you might be assigned a care coordinator for a knee replacement or a cardiac rehab. But they are often focused in specialty care. So they could be a solo focus, such as, you might have a care coordinator who works with families who have a newly diagnosed child with diabetes, when they do that connection, or it could just be an epilepsy, new diagnosis. And so those are very focused efforts, but we have interdisciplinary clinics also that are often hospital-based. I'm thinking of like Boston Children's has a neurodigestive clinic that works with families who have kids with GI and respiratory disorders. We have neuro-oncology clinics that have, neurologists who work with kids with brain tumors, or complex care clinics at some of our Boston Children's or up at Dartmouth. And those are multidisciplinary, many specialists working with that family. But there are also some interdisciplinary clinics in the state that are in community-based level that can offer some consultation and coordination. So think of our child development clinics or the complex care network out of Amoskeag. So families will hear, do you have a care coordinator at a multidisciplinary clinic or at a multi-specialty clinic? There, again, even those are not one size fits all. And then we get to community-based models of care coordination. And this is where the confusion really hits for families. It's a huge category if we think of all the places where families access care within their community. It often feels really disconnected for families from the medical piece. We could have families as examples. We might have families who are enrolled in healthcare coordination through our Bureau of Family-Centered Services or any of its community-based contracts. So, are you connected to Bureau of Family-Centered Services or is it Waypoint? Families are like, well, I think it's Waypoint. They could have service coordination, right, through Birth to Three, early supports and services. They might have family support through an area agency. They might be involved in a home visiting program, and those might look quite different for them. They could perhaps have been involved in early childhood wraparound. And we can't forget that they might also have a case manager or a care manager with their one or both of their insurance companies. So all of these different models and access to coordination can be really confusing for families. And as we work with families on the individual level and with them on improving systems, we often discuss that family engagement, right? Family engagement. This is what we have to do in order to help this make sense. So before we can talk about any of the specific challenges and the potential solutions in care coordination, we really have to take a deeper dive here in the family engagement.
So what is family engagement? PIC's definition of this is a partnership between families and professionals working together to achieve shared outcomes. And it's a process through which families and professionals build trusting relationships. And this requires commitment from all individuals. And this matters both at the engagement level and in the systems building levels. And this also just doesn't happen. Trust has to be established first. And a lot of the times these families are in, have been in crisis mode, or they can be. So adding another person to their list is kind of daunting. So just keeping that in mind, what we hear from families is that they want a consistent person, which is the start to helping build that trust. Thanks. And so why does this matter? Obviously family engagement, it sounds pretty self-explanatory. You want working with the family, but let's break it down and see what that really means. It improves the outcome for both the children and the families, but also it improves your professional outcome. It helps strengthen your work in your practice and making your programs relevant for families and accessible. And what we hear the most thing I hear, even working with the B8, I have asked this question to them, what makes you feel heard? Is when they're validated and that they're respected. And this, Sylvia and I were chatting about this on a personal level. We find often that because we have personal experience, but also on the professional side, that sometimes it's difficult to be heard and feel seen when we are able to articulate our needs or our child's needs because of our experiences. We often find that sometimes providers will just think that we know or that we have all the answers. So we were just chatting and just realizing that it doesn't matter which family you're talking to or what you think it's like for them. It's safe to not assume that no matter how somebody presents themselves, that they don't know, or they may need support even when they don't ask. And of course, this engagement, this work with families on a personal level, you have to make it personal, is also something that I've heard from families who have care coordination experience, that if they feel like they are cared for and that they are heard and that they are seen, then they're more likely to, give other information or ask for help. And this improves and increases everybody's, success. So we weren't asked to speak on this part of it, but we really think that hearing from families and asking them, what matters to you, or have you had experience? And I've asked the members of my B8 team this question to see, if they had any experience themselves. And what I heard overwhelmingly is that there needs to be the trust that is established first in order for these relationships to build. And that is really what care management is and family engagement is. It's building a relationship and meeting the families where they're at. And so how do you do that? How do you gain somebody's trust? Especially a family who sees multiple people, who doesn't know who's helping them with what, or they've explained their story and their child's symptoms 500 times, and now they have to explain it again. So what would set you apart is just being honest. This is what directly from the mouth of families is, be honest from the beginning. If you are not able to provide them the support that they need, then be honest. If you have to look for more answers, be honest. If you can help them, be honest. And also have conversations with them, meaningful conversations. We'll discuss this later on, and I know you're all aware of the challenges of staffing and the timing of things. And, there really isn't time to make these connections and have these conversations. But when it comes to families and to make them feel important, it's essential. You really have to take the time that you do have, and, make sure that they do feel heard, even if it's within a couple of minutes of your time. And if you continually show them that they matter and that they are priority to you, it's going to make a huge difference in the way that they succeed, and then your practice will succeed. I said that already. Consistency is key. And most of all, families know when you're invested in them, and that comes from families in all shapes and sizes. Sylvia and I, when my daughter was first diagnosed, that first 24 hours of finding out what her heart condition was, my husband and I, we became professionals overnight. And so we were able to, and we were in Boston, so they know what they're doing, but just letting them know that their voice is heard, and that no matter the circumstance, like these families know their children best. So if you can keep that in mind as well, like show them that they actually are the professionals as well, and that you're on the same team with them. Okay, skips.
So now we're going to talk about engaging families at that systems level work. So we were asked to really speak to us. So how do you get from working with families on an encounter level to saying, I'd like their feedback. I'd like them to participate in making something better at our practice. How does that happen? This is where we do a lot of work at New Hampshire Family Voices and PIC. So the first thing I can say is you need to be really mindful about who you're looking to engage and why. So to be really thoughtful about that process. It doesn't really help. The example I give all the time, if you're looking to improve no-show rates, it doesn't help to gather a whole bunch of families who always show up for their appointments, right? So what are you working on? Who do you need feedback from? And then be strategic. Once you've identified who it is, it's like, so how do I go about finding these families? If I send out a thing on Facebook and I know some of the families I'm looking to reach don't use it, I'm not going to find them. So think about, developing a plan for how you're going to engage diverse perspectives. You want to make sure that you're engaging perspectives that are representative of the families you serve. So where are the places you have to look and ask in order to do that? And then perfect your ask. And what do I mean by that? Who asks the family and how they ask and why they ask really matters. So we've had families say, I was asked by a person I really trust at the practice. My pediatrician asked me. The care coordinator I have a relationship asked me. And they imparted that I was asked because they believed I had value to contribute, right? So I came to the table because someone I trusted asked me and told me, you've got something to share. I know you could help me make it better for other families. So it really matters thinking about, how you're asking, who you're asking, and then who does the ask. Really take time to think about what you're asking families to participate in and making sure it's accessible. Thinking, what time of day are we going to have this meeting? How long is the meeting going to last? Are we going to do it virtually or in person? How often are we going to meet? And what overall time commitment am I asking this family to contribute? Really think those things through to make sure you're not inadvertently creating barriers for families to participate. We had to do a training for a patient family advisory committee, and they couldn't figure out why they were having difficulty engaging families. They were meeting Thursday morning at 9 o'clock. So that was really convenient for the professional members who were being paid to be there, but they were asking volunteers, family members, to not only volunteer, but then to miss paid time from work to volunteer. And that was not possible for many families, right? So it created a barrier for families who would otherwise have really liked to participate. And then I can't say enough about setting families up for success. So if you're a brand new family member who has never participated at this level of systems work before, you may or may not come to the table with a degree of confidence and a need for mentorship, right? So making sure that there's orientation, not just for the family members who are participating, but also for the professional members who may never have shared decision-making at a table with families before, but that some grounding documents are created and some orientation occurs, and then some ongoing mentorship happens for those family members. So if they're struggling with how to participate at that systems level, that they have someone to go to, a family organization representative, somebody who they can bounce ideas off from, so that they can figure out how to most effectively participate at that level. Really important to set those grounding documents to be clear about what we expect of all members, sort of those ground rules of we're all equals at the table. The doctor takes off their coat when they come in, and we're all equal participants at this table. So really making sure those pieces are addressed. And then on an ongoing basis, addressing any barriers that come up for participation for family members so that you can keep them engaged at that system level. So now we're going to start talking about some challenges to effective care coordination. None of these are going to be a surprise to any of you, right? So we know that at the systems level, there are a lot of challenges to effective care coordination, right? Our systems are set up in silos. They are by nature fragmented. That makes it difficult to coordinate amongst, between, and within, as the standards dictate they should. The way the system is set up makes that difficult to happen. There's not sufficient connectivity or interoperability between all the different electronic health records and databases and tools that we use that would help to make that coordination more viable, right? So, and that happens because of the privacy and data security concerns, right? Just a reality of the systems that we work in right now, and how some of the pieces about those systems make it a barrier to provide care coordination in the way that we would love to provide it, and in the way the standards say it should happen. And then I think this says the resource and staffing limitations is last, but it's by no means last, because I think it's what we all feel first and foremost, right? So we don't have staff, enough time in the day, enough hours in the day. It's not compensated at the level that we need it to be compensated for in order for the work to happen in the way that the standards outline it. And I think this applies regardless of the setting. So when we're talking to families who have coordination of some kind, regardless of the system that it's working in, they all identify, well, I'm not sure there's time for that. It doesn't seem to work that way. And I think that's universally true, that we don't have enough bodies or hours in the day to do the work in the way we wish that we could do it.
And just as, there's challenges in every relationship. I think that if we focus on this family engagement and care coordination as a relationship with families, it'll kind of put us in the right mindset. And so that comes with, the lack of trust that I spoke about earlier. And what does that look like for families? What does lack of trust look like? And I think that a big factor that impacts this is fear of judgment from professionals as a family member, whether they're feeling like whatever they disclose is going to be shared, or they don't know who it's going to be shared with, or just that they're not doing a good job. Because I think that when it comes to being a parent, that's often a question. We often feel like we're falling short. So just remembering that, especially with a kiddo with complex medical needs, or, like Sylvia was saying, multiple cooks in the kitchen, all hands on deck. It's kind of overwhelming, not kind of, it is. And families might constantly feel like they are not succeeding. So that plays into it. The lack of trust is really difficult. And also, I think a huge part we haven't really touched on yet, and this kind of impacts on multiple levels, especially relating to staffing, is a follow through. Like, if I ask you for help, if I share a question, if I have a concern, and you as a provider tell me that you're going to look into it, or you don't know the answer, but you're going to help find out. If there is no follow through, it is nearly impossible for that trust to be established. So keeping that in mind when you're working with families, that we know in our profession and as families, it's not realistic for you to remember all of the things for all of the patients, and um, we all fail on that level at some part. But remembering that in order to build a successful relationship, there has to be that trust. So whether it's one thing that you can, and it could be simple and to start out. And if you do follow through, that family is going to feel heard and valued, and they are going to open up more. And, then that leads to all the successes for both parties down the line. Let's see what else. Coordinating the coordinators. As a family member with multiple, you know, appointments and multiple children, that's enough to juggle in itself. So just remembering that it's not always easy, and it's not always realistic to assume that all of the coordinators in this family or this child's life are going to be on the same page. That's not realistic. So I think one, being upfront with families about that is incredibly important. But doing your part to form those connections with those that you're able to coordinate to help relieve some of the burden for families is incredibly important, and also will build that trust and feeling of being secure and that they feel supported. And it doesn't feel good as a family member to have to repeat my story or my child's story or their symptoms or what medication lists they have. That is really tiring. And it doesn't make me feel valued or heard or cared for. If I have to repeat myself every single appointment that I go to. And we understand also that, it's not realistic to hear. Every provider is not going to know everything, but to make an attempt, it would go a long way. And I mean, these are, I think, probably the hardest part is meeting the families where they're at, right? There are economic and social factors that are going to impact any family or any patient on any level. Kind of goes back to Maslow's hierarchy of needs, and, some things take priority. And although you're not going to be able to know a family's needs unless you have a conversation with them and they feel comfortable enough to disclose that information to you, it's kind of a guessing game. But just kind to put yourself in their shoes and ask those questions like, how many kids do you have at home? What is your job like? Are they supportive? Different things like that. How are you getting here? How's your transportation? All of those things that impact a family at the care coordination level are really important to make them feel heard. We're curious if there's any other challenges that you all experience at this level, this family level. If you see any, you can add it in the chat too. We can talk about that at the end.
So now we're going to talk about some innovative practices. So first, we know there's a lot of work and improvement that's happening that's focused on improving communication of information. There's a lot of investment that's happening in IT and electronic health records that sets up workflows. So those pieces, we can't speak to because, we don't work in that piece level. We're bringing the consumer and family perspective to this discussion of innovation. And from what we're hearing from families and what we've shared already, it's really about finding ways to improve communication and reduce the fragmentation in and amongst systems. So directing your question to the family, who is on your child's team or on your family's team? Who are your helpers? And we use the term helpers more so than coordinators, because as we've talked about several times already, families don't necessarily recognize a standard definition of coordinators because they look so different, right? So they may say, I have a coordinator in this system, but she only does this, and I have a coordinator over here, and she does all of that. So it doesn't feel or look consistent. So they may not always identify them in the same way. So asking, who are your helpers, your go-to people, when it comes to this service that you're asking, that you're, accessing for your child? And so it's really important to think about those pieces and then to identify what is that family member's preferred method of communication. Because what you're trying to do is to figure out a way to really take what has happened in practices in like a primary care practice, some of these models of team huddles and that happen in practices where there's quick little ways for team members to touch base and spend 5 minutes talking about the needs of a family. How do we employ that strategy bigger? Right? How do we, once we know who the team members, the helpers are for a family, how do we test those kinds of innovations that worked at the practice level and broaden them to the bigger team level that works with families, and so those are the things that we are, encouraging you to start with the family and ask the questions for.
Yeah, you can go back. That's fine. Thank you. So, I see the comments in the Janet, your comment about it feeling impossible to develop trust in relationships. And I kind of, if you're able to, could you tell me more about what you see as a barrier? I'd be interested to see if we could at least make one improvement for you. Since impossible seems really challenging, and that's difficult for family on the family end and the provider end, I would imagine. So if you have any extra comments on that, I'd be interested to hear what you have to say.
Yeah, and my, excuse me, my experience at this point is remote because my child that I'm most engaged with is an adult now, but we were constantly getting assigned people to come into our home after a hospitalization that had a very limited amount of time that they were to engage with us. And then as soon as my child got it all attached to that person, then the service ended and we had to start all over again with somebody else. And it was very difficult to look at that person in a transitional role and say, oh, I'm going to invest any of my time managing this person and all the other people in my child's life.
Yeah, I understand that. That transition piece, I think Sylvia could speak on too, transitioning in multiple ways, whether it's in the hospital or out of the hospital or changing staff. That goes back to the staffing piece as well. The turnover is very difficult, and turnover in any environment is very difficult to establish trust, and it does feel impossible. So you're right. I can see that as a family member myself, and in this professional role, and I'm sure you all can as well. Go ahead, Sylvia. I can see if you're something else.
Yeah, I think it's the episodic nature of things. So some roles are time limited, right? So figuring, and I think that's the part that leads to the frustration for families, helping families to understand which of the roles of helpers are going to be here for a short period of time and what might that time look like. And who are the helpers who might be in it for a longer period of time, so that I have an expectation. This is someone I can call after this initial period of rehabilitation or home PT after a hospitalization. And then this support's going to fade out. But these people will be consistent. They're here more long-term. And I think that when we clarify for families what those reasonable roles and expectations are from different sorts of helpers and providers, we reduce frustration that was just spoken to, right? It's really hard to build long-term trusting relationships if you have somebody coming in, you're like, oh, they're only going to be here 2 months, and then they're going to go away. So figuring out who are the people who are going to be more constant in my child's and our family's journey, and so that I have those expectations is really important. When Kendra and I met and we're talking about who are your helpers, I think it's part of that confusion of not knowing, as a family member, what are the subtle differences between a service coordinator, a care coordinator, a case manager, a care manager, all of these numbers of people that might be involved in our family. So even harnessing that, having somebody help the family to harness who are all these people and how long, are they, going to be a part of your family's journey is really helpful in helping families to have reasonable expectations of what that support might look like. It also helps us know who we call for help as opposed to making 6 phone calls to, and 3 of whom are like, yeah, that's not really my role. So it really helps families to have an understanding of all of these roles and responsibilities and the duration of them.
And I think it's also important to keep in mind that families' needs will change over time, especially if a child with, complex medical needs with, multiple symptoms. And, my daughter's heart condition is going to change as she grows, and eventually she'll need some type of intervention when she's older. So right now we're not in the thick of it and we don't need extra care, but we will. So knowing who to contact for that support is, a kind of an unknown. And that's a personal share, and I'm in this role with New Hampshire Family Voices. So, and to be honest, I didn't know that a New Hampshire Family Voices existed prior to my employment. And this is a huge missing piece of the puzzle, I think. So feel free also to reach out to either us or pick if you have families who are needing that extra long-term, that person who can be consistent with helping to identify what the need is and who to contact for help. We're happy to do that also. It was a shameless plug, by the way. But I think it's important the important part, I think, is one, just to be honest, right? Janet, I think it might have been helpful for somebody to say to you, and I don't know, maybe you did hear this and maybe it didn't matter to you, or it didn't help feel like you mattered or that your child mattered, was that they were honest and saying, listen, this is how long this is going to happen for. This is what you can expect after. But I think the important thing is just truly being honest. Like, I don't know how long you'll receive this service, or maybe I do. But being able to point them in the direction of other resources that could help them bridge the gap until they have that next consistent person. And yes, absolutely, it does seem impossible from the family perspective to ever trust somebody again when it's a constant cycle of in and out and in and out. And especially for a young child developing, when they're learning relationships and how they develop, that's incredibly difficult for families to explain. So I think it's helpful to understand what resources are available for families outside of your care. You can't do it all. We don't expect you as families to do it all, to have all the answers. But if you're able to share with families other players, on the team that can help kind of make those transitions smoother, and they're never going to be perfect. That's, I think should be clear from the beginning. There will be bumps, but also just using the resources that are available for families. And I think what's important about New Hampshire Family Voices and PIC is that we're able to connect families to other families going through something similar. And this has also been some new feedback that we've gotten, that families want to know that they're not alone. So that's also a huge tool for you to use. If you can't provide those resources for them, you can say, I know of a family, or I know of an organization that has family members who have been in your shoes or who are walking the same path, something similar, just to help them. Yes, Lisa, it's important. And families often feel isolated also in these, paths of multiple care coordinators. It's incredibly daunting to do it on your own unless you open your mouth. You're the one who says it first. So just being mindful of, what other support you can give. If you can't give them you can't provide them with exact need that they have, then to show them possibly where they could go for some help is helpful.
And I want to give a caveat so that, I recognize that sometimes asking coordinators who are already so busy that they can't see the end of their to-do list to reach out and engage in things like team huddles and team meetings with other members of the expanded team feels like more work. But what we've heard from coordinators is once families have a more reasonable expectation of all the players and understanding of the roles and responsibilities, but also do all the coordinators, the burden is actually better, right? It's reduced because now the load is shared. It takes some work to get there, But then it's instead of the family calling 5 people and asking for information, you know, or coordinators asking the same because they're not sure who followed up on what yet, you're working more cohesively together. And so sharing the load. So you as a coordinator also don't feel alone in helping that family to navigate whatever is happening, just like the family no longer feels alone when they're connected to peer support. So it can feel daunting and overwhelming. So I would say feeling like, exactly, coordinators duplicate work sometimes because they have to. It's like, I have to make this call monthly to this family and I have to ask them all these questions. And then another coordinator at a different system is doing the same thing. So how do we work together? You know, we both gathered the information. You just talked to this mom yesterday. How can we work together to address the needs that she identified? You know, you don't have to, you've gathered the information, you made the call. You can do this part and I can do this other part.
And mom
simply
doesn't get annoyed having to answer the same questions over and over again, because that's really what happens.
and it also
Or dad.
or dad or grandma or whoever happens to be
Exactly.
the
Whoever's
caregiver of
taking care of
record.
that kiddo.
Yeah. And I think it's, you know, for family members, it then feels really supportive. They know they have people who can, you know, do the work and share the load, and it doesn't feel quite so burdening and overwhelming. I think the team meetings we've seen in a number of quality improvement practices that projects that we've done in various projects, figuring out who needs one, right? It's not all families need a team meeting, but there are going to be key points in time where a family might, you know, and so, you know, figuring out with the family when that sweet spot might be for that family. And it might not be the entire care team because some families have really huge ones, but maybe there are 2 or 3 key support people or helpers that it would be a good idea to convene. And then how do we use technology to do that? You know, we used to literally have meetings at a practice where people from the school came and people from the early supports and services came. There'd be 10 or 12 people around a room. And just trying to organize that to find a day that worked for all of the people was an onerous task. You know, the one thing I can say about, you know, COVID is that, you know, having virtual opportunities to meet has made some of that a little bit less daunting and removed some of the barriers for families. We've had some families where care coordinators and practices are using email, but, you know, making sure that it's secure email to, you know, start a conversation on mom's behalf. And so, you know, there are ways to make sure some of these connections happen that reduce the workload for everyone and improve communication across the members of the care team where it's really priority at this point. We encourage you to start small, you know, so if mom's got a list of helpers that's 12 long, doesn't mean you have to go out and start developing relationships with all 12 of them tomorrow. Pick 2 that mom says is the priority, start small, and then work from there.
And just also to speak on that, the team meeting, just also remember that families might not know that's an option. Um, you know, that encourage them to speak up for themselves. That will go a long way, as far as building trust. Also from a personal experience, when, you know, if you see that there's an opportunity that, the family could benefit from a team meeting, encourage them to speak up for it, and to ask on their own. It will give them, you know, the power, and they will feel empowered to speak up more, if you turn that over to them and, you know, kind of make it their idea, because they also might not be aware of that. Just a small thing. I see your notes in the chat too. I think that, Liz, I think that the disconnect, at the systems level is also a huge problem. Not problem, but challenge, barrier, as far as, you know, it's kind of similar in the same terms as, staffing and, you know, the time that providers have. I think it's a lack of knowledge of resources and who can help who in their area. So I think it's important on the systems level for the communication to be stronger. Yes, and clear and definitive roles are really important. So the people know who's doing what, especially if families, for them to understand who the players are at the table. And just to remember for everybody that everybody's at the table for that family. They're on their team. they're there supporting them, and it's not just another to-do list or task they have to get done in their day. Do we have any questions? We kind of just dumped a lot on you. Can anyone share something that you're doing in your practice that has been innovative and helpful that you found engaging with families in care coordination that somebody else might find helpful?
Hi, this is Lisa Spears. I am one of the supervisors for AmeriHealth, one of the managed care companies. I'm the supervisor for PD and maternity high risk. So we have case managers, which a lot of people don't realize that your insurance company has case managers. But we do case manage those high risk population. We have nurses that are pediatric nurses, maternity nurses. But I encourage them. I worked for a long time for the VNA, so I've been in homes and out of homes doing care coordination. But I try to encourage the nurses to, obviously collaborate with the physician's offices. Sometimes some of these kids wear their secondary insurance because they're high medical needs. So collaborating with the primary insurance care coordinator so that we're definitely not duplicating work. But a lot of the times folks don't realize that, when you're getting a denial for your medical equipment or for medications, that there is a care coordinator that can help you, that, can work through that. If you're trying to get a shower chair for your child and it just keeps getting denied, we can work with you to get that approved. And I don't think that a lot of people realize that the insurance companies offer that service. So that was one of the reasons we really wanted to jump on this, just so that everybody knows that we are here to help. I can put my email in the chat if anybody has any AmeriHealth members that really could use our help. We are more than happy. We take referrals for case management care coordination with anybody. So I'll put my email in the chat. But like I said, we really try to work. Sometimes we'll have the care coordinators will ask the mom, is it okay to call the PCP on your behalf to get that medication covered or to help with that prior auth, just to take some off the plate for those families, because you're right, they're running and they have so many other things. If we can assist at taking one thing to help them ease their day, we're willing to help.
Yeah, that's great. I think that's huge too. Just knowing that there's somebody else just to make that phone call. I feel like phone calls are so challenging. And I'm sure that has to do with, our ability to text people and, email and eliminate the personal contact. But as a mom with lots of kiddos, I think if anybody could, it's like, could you help me do my laundry too? That sort of thing, like just that one thing that just means so much. And I know that it might not seem like a big task on the professional side, but alleviating one thing or just asking to, when you make those connections, when you don't have the time, when you have a full list of patients that you have to get to, or you're in and out of homes, or your own personal life is pushing on you as well, just remember that those families are human and they just want the connection. So just stopping and asking, like, how are you? And really listening to what they say. And I guarantee you will unpack a lot in just that one question. And I think it will be beneficial for both, on both ends, of that. So it might seem like, oh, I don't want to open that can of worms when I have more clients back to back. And, but just know that just asking how somebody is, or, that one personal connection can open the door for the trust and that start of relationship building for families. Perfect. Does anybody else have anything to share? Any questions?
Community
Perfect,
health
Lindsay.
workers. I'm reading a comment about community health workers. We've heard a lot of that has been, one of the real pushes. When one of even the diagnosis specific organizations, the Epilepsy Foundation of New England, has a whole slew of community health workers who are
Yeah.
doing resource work and connection for families. So it's definitely, we've been hearing a lot more utilization of community health workers as that direct first line of support for families.
Yeah, AmeriHealth also has community health workers. And we send them out to assist with paperwork, helping a mom sign up for SNAP or housing needs or Social Security. You know, if they struggle with that, we definitely send them out to the home as well, or meet them anywhere. Anyway, we have a big meeting space at AmeriHealth in the Manchester office that is community, open to the community, and we've met people there. There's computers there, so that we can help, you know, assist with any of that, filling out any paperwork needed or anything like that.
It's a huge benefit, you know, as some of those, because what we hear from families a lot of times is it's the that's the barrier that gets in the way, right? Is
Yeah.
the application, the paperwork. So support for completing redeterminations and
Yes.
applications has been really unnecessary. We've heard of several families who've had gaps in coverage, you know, because they
Yeah.
had, you know, life circumstances that they just
Right.
could not get things done. So having, you know, meeting families where they're at, but having the trusting relationship, as Kendra said, to be able to ask, is that something you need?
Right.
And sometimes families are afraid to say, I can't do paperwork, you know,
Yeah.
or I'm
Yeah,
having
or they don't know
struggles.
what they need.
Yeah.
Also,
Yeah.
you know, identifying the need is also really challenging. But I wanted to speak on the home visiting piece. And how that feels as a family member too is kind of, you know, that's kind of a scary thing to invite somebody in your home. And I know that fear of judgment is the underlying factor. So that's an opportunity to establish that trust, you know, and it's very important that that doesn't, you know, it doesn't get ruined right away. You know, making the family feel comfortable that, you know, what their house looks like doesn't matter, you know, obviously keeping in mind safety concerns and, you know, the well-being of the child first and foremost. But also like it's scary. Like I don't know that I would want anybody else to come in my house right now with my, you know, like my dishes are in the sink and, you know, it's just even if it's not that bad to the outside eye, personally, it feels like a lot and it feels really stressful and just eliminating that. And I also know it's challenging as a professional to go in other people's homes as well. I did some home visiting with Head Start, and that is also really intimidating. And you don't want to, you know, be overwhelming or, you know, that sort of thing. So just being mindful of that when you are going into families' homes, just keep that in mind. Yeah, and it is easier, right? It is easier to have people come home. Like I'm not able to have childcare, right? So yes, it would absolutely be easier for you to come to me versus, you know, getting 2, 3 kids in the car with, you know, in the snow or traveling, or I don't have money for gas to get there. And I don't want to ask and I don't want to say that I need help. So could you please come to me, right? Like all of those things. Yes, family resource centers, but also remembering that families don't know about these things. I think it's best, if you go into the mindset of that your patients don't know the things that you know, right? Regardless of how they present themselves, whether you're talking to myself or Sylvia or a family member who's, you know, new to this, a new mom, you know, all of these things, like go into it and thinking like this person has no idea. And every time you go in, you share with them what's available. And if you don't know, ask us. We're happy to help with what we know, and connect you with other people that could give you the answer. You know, I think there's multiple um, uh, employees with PIC and New Hampshire Family Voices that have, you know, an outreach of, you know, whether it's working with the coalitions or, you know, different family groups or focus groups. So just ask and how we can help you connect with families. That's our goal. Amanda, I see your comment in there. Thank you for sharing your information. She's great, by the way.
Kendra and Sylvia, I have a question around incentivizing or incentivizing families to engage in you know, systems level or practice level planning work. And maybe if you could just reflect a little bit on some of the values and strategies that are really important to consider in that work.
So if you're talking to families about being systems advisors, essentially, right? Being a consultant to helping you improve something, you should pay them, right? You should provide them something to support their time. You can't ask families to incur childcare costs to come to meetings or to leave work time to participate in something to help to improve the system for families and for yourself and for the system itself without providing some form of support. So it is best practice to provide stipends of some sort to support families doing systems level work. And it's really to defray the other costs that they're incurring in order to participate. We always say we don't ask most of the professionals sitting at the table are being paid, right? So they're doing it on their work time. And so it's an equity issue to ask family members to come in and not be supported. We had a we had a patient family advisory committee, and we said we encouraged them to move their meetings tonight occasionally just to see if more family members could participate. We said, what happened? And they said, well, the doctors left at 5. I said, why did they do that? Well, because their workday was done. So you asked the family members to come on their own time and to give of their own time during dinner time. And they found childcare for their kids and came, but the doctors left. What did that say about the way in which you valued their participation? What unintended message did that send? So, it's one of those be mindful things that we encourage families, providers to think about when you're thinking about creating these opportunities. We don't ask, us to work for free.
Exactly. Or to share our input for free. And I think to speak on that, the B8 is made up of families and community providers that work with families birth through 8. And we struggle with finding a time that works for the families to meet. And we've asked multiple times what time is easier for them. And they've asked to push our meeting back until 7. Because it's after bedtime. They don't have to worry about the rush. So making a realistic effort to meet families where they're at, a 7 o'clock meeting at night is realistic for them. That's helpful, and that would make them feel, valued. And also remembering that if you want a family to provide feedback or to help you with the change, the families you need to ask are the ones who are fired up, the ones who are difficult, the ones who have a lot to say. You want them on your team. They will tell you how to fix your problems, and that's who you really want to ask. You shouldn't be afraid. You don't want the family who, not that they don't have valuable input. Don't get me wrong. I think every family has experience that is helpful for somebody else. So asking them all is really what you should be doing. But especially those families who are difficult, who, take up the most time, have the most questions. You've explained something to them 5 times, right? Like, keep explaining it to them and ask them if they want to help other families figure out the answers to those questions they're asking. So just remember that. Ask families who are difficult and challenging because they have a lot to say. Yes, Amanda, and agreeing and advocating for families on your side of things, right? I know that can be challenging as well. There's barriers inside the workforce, and who has the say and who has the pull, and you're gonna have to be mindful of your own position, but we need you to speak up for families when they're not able to, or when you know that something is wrong, or that they are maybe afraid, or that they've disclosed something to you, but they're not able to share it with the full group. Speak up for them. That will, again, go a long way as far as building trust and empowering them to use their voice, which is really important because, again, they are the experts on their child.
I know we've covered a lot of the challenges and talked through some of the barriers that that providers face in kind of providing that care coordination helper type support. I'm curious if anybody would want to share a moment within your practice that you've been really proud of, where you feel like maybe you didn't crack the whole code, but took away a good chunk of the wall. Just to, share some successes.
I'll speak up for you all. And I think just having you here speaks volumes. You're here listening, you want to do better, you want to know how to support families, and that's a huge step. So we're thankful that you came and you listened. And we hope it was valuable to you. Because just having this conversation is the start to some change. Keeping in mind those barriers that we have no control over.
Right. Do we have any last questions for Kendra or Sylvia or anyone else in the chat? I know Liz Fitzgerald had left a note about potentially having a list of people within the insurance providers to kind of get the primary care coordinators, case managers, contact information. So that's something that our team will look into pulling together if it doesn't already exist, which I imagine it might somewhere. So, all right. Kendra or Sylvia, any last thoughts?
No, just that we're here to support you, to support families. So if you have any questions, or have any other follow-up on how you can make those connections with families, please reach out to either one of us. We'll be happy to help.
And we have the evaluation link. I know it's up on the screen with a QR code, but Kara will also put the link in the chat. We will send out a link to the recording after the meeting. And we just really appreciate all of your time. I think Kendra summarized it beautifully just by saying thank you for being here and for being invested in learning and helping connect families to the services that they need. So hope you all have a wonderful day, and we will see you soon.
Bye. Thank you.
Thank you all.
Thank you.
You're on mute, Katie.